Hi, I'm Sydney, an ambassador at Hive 80, and today I'm here with Dr. Buonfiglio, who is a therapist, and we're going to be talking about the pandemic and mental health, something that a lot of teens and adolescents have many questions about these days. So we're going to first be starting with the question, given the pandemic and the increase in other stressors, have you seen an uptick in visits?
I have seen an uptick in symptoms for sure, and I guess in visits as well. But many people have concerns. They have issues in relation to depression and anxiety, and the pandemic is just further exacerbating some of those symptoms for folks. So a lot of the work is around symptom management, right, and helping the folks to be a little bit more stabilized and feel a little bit more comfortable, and that will create space for some more deeper work in time. But for right now, we're just managing and working on some of the symptom management.
That makes a lot of sense. So what are the most common worries that you're seeing right now?
Well, we have a number of different things. I think one of the things is the fear of the unknown. I think that's really something that consumes folks, is like what, how, when, like all these questions that we don't currently have answers to. And trying to help them with things that are within their control and manage the things that are out, and knowing the difference between the two.
Yeah, that makes no sense. So is it normal to be a little bit stressed out right now? I know I'm a little bit more stressed than usual.
Well, yeah, I think there's a healthy anxiety or normal anxiety that can be really helpful to people. It helps people to consider putting on a mask or social distancing, right? That's anxiety is kind of giving us that information, so that's important, and then it can be helpful to folks for sure.
Right.
But if it becomes too consuming and overwhelming, that's when it's problematic to people.
Okay. So what symptoms do you see that indicate that you need a therapist?
I would say we can talk about symptoms, but one of the things that I think is a really strong indicator is how someone's functionality is, right? If they're not able to function as they normally do, right? If they're down on most days, if they're irritable, if they're worried, if they're nervous, if they're stuck, right? These are certain symptoms that folks might have, but they need to notice those symptoms in relation to their functionality. And if they're not able to do things as they used to, then it's a good time to seek help.
Right. Okay. So how might teens know if they have anxiety or depression or even need help?
That's a good question. I mean, I think there are sort of online tests about generalized anxiety as well as depression scales that you can certainly look up and take a look at and see how you score, and that will give you an indicator of where you're at. Yeah.
And we'll link some psychologist or therapist approved links down below.
Yeah, sure.
And it's now the time to reach out for help and ask for a therapist. When's the moment?
Again, I think it's the functionality component, right? And if you're really stuck and in a place where you can't do the things that you used to enjoy doing and you feel quite different in that way, that's, I think, the best time to reach out to talk to somebody. Yeah.
So to anybody out there who might be feeling a little bit more anxious or depressed during this time, do you have any closing advice or words for them?
Yeah, for sure. I mean, I think it's really important to talk to people, let them know what you're experiencing. Don't keep it in. Talk to your parents, talk to friends, and seek help, seek professional help if necessary. I think that's really important.
Great. Well, thank you so much for being here. For those of you out there, if you're feeling stressed or depressed or anxious, make sure to drop a comment and start a conversation on Hive 80. Thank you all so much for tuning in.